Medicine is in my family. My father was a physician before he passed away, and I was always really exposed to medicine. Initially, I actually didn't want to become a physician. I wanted to become a medical anthropologist. Medical anthropology is the study of medicine practiced in other cultures. So in my case, it was Native Americans, specifically the Navajo people, and then after finishing my medical school and residency, worked as a physician on the Navajo Indian Reservation for 3 years. Basically, Native American religious healing was kind of where medicine and religion met. And I was fascinated by how other cultures look at medicine and healing, and how they sort of looked at it from a little bit of a different perspective than we do. And I think whenever you can work collaboratively with a patient, I think the outcomes are better. It's easier to form trust. And one of the things I understood is that a lot of the things that we see here in Chevy Chase, people suffer from there. They may call it something different, but at the end of the day, it's about building relationships. And the relationships I had with people there across cultures were as strong as any relationships I've had with patients. So I really realized that that doctor-patient relationship transcends cultural boundaries, that it's about that essential human connection that you make with somebody else, and not about the language you speak or the way that you were raised. So the Navajo people think about health as being a state of balance or harmony within themselves, between themselves and other people. I try to take some of my lessons from the reservation and apply them to my practice now, and specifically this concept of balance, because I think living a balanced life is really the essential core of leading a healthy, happy life. For people who are willing to see things that way, it can be a helpful roadmap for them. And that's why I keep a Navajo sand painting in my examination room to help remind me and help show them this concept of balance, and to help them conceptualize it as a concrete idea that they can grasp onto. I also volunteer once a month at a clinic for people without insurance called Mobile Med, which serves residents of Montgomery County who don't have health insurance, and I provide rheumatology care to them once a month. I think it's important to give back to the community. The community certainly provides a lot for us.